the body. So that is a huge, huge change in how our healthcare approaches. And as massage therapy being at the bottom of the chain, we don't really have, exuberant amount of codes to build to these medical companies where we're making extravagant amounts of money. So at the end of the day, it's more along the lines cutting costs, making sure that that person is following suit for what they feel is good for them, and then taking any future issues, and sort of taking them into consideration. And in regards to insurance, if we can plug in a piece of software into our cars that's going to lower our insurance, why wouldn't we do the same thing to people if it's going to lower their insurance for the long term outcomes? So that's pretty much where I'm at with that.
Yeah, which, is a fantastic example of effective cost savings, right? You talk about cost savings in medicine, and that translates to the average person of decreased quality of care. In this case, it's improved quality of care, which in turn decreases the cost to the healthcare system, to the patient. I'm sure the patient satisfaction is fantastic, and provides a very viable, long-standing, solution to some of these issues. And I think that's where we as providers and we as advocates for the healthcare systems are really trying to find that, if like, most efficient, cost effective, best quality of care for our patients. And I think this is a fantastic example, and I am a proponent of massage therapy, let me tell you, for multiple reasons, least of which, when I go on vacation, I really need one. um okay, so Dr. Ganju, so okay, AI scares the dickens out of me in many, many regards, and then I'm super excited about it in others. Like, I'm part of this hospital steering committee at Epic in Verona, Wisconsin, and we're currently working on different AI models to help as clinical decision support and decision support tools, and developing that within their electronic health record. And I'm one of their advisors, and so I'd like to know, how can specialists integrate AI to really enhance care delivery, and what does that look like for your patient population, which is the menopausal woman? Because I'm getting there.
Yeah.
We're all getting there.
This really plays into sort of the biggest question of AI, which is how do you ultimately trust it?
Mhm.
And to me, that's heavily based on how did you train it? And so we've taken actually a slightly different approach than sort of the mainstream approach to AI, which is gather as much data as you can from as many places as you can, create the model. There is an alternative, which is what I think makes more sense for healthcare, especially in our field, women's health. If there's any other area where trust becomes critical and essential, it's in our field.
Mhm.
Once you break it, it's gone.
Yeah.
Um, so in our field, what we have figured out in our company as well, if I trust my doctor, train the AI on the doctor herself.
Mhm.
And this is kind of the approach we're taking, which allows trust to occur. The physician can now trust this model because it's speaking and displaying behaviors that are your own. The patient trusts the model because the patient trusts the doctor.
Mhm.
So this is an approach that to me is much more reliable and much more favorable, and this is what we've been studying in our research of the models we've developed. Um, Now compare that to a big, large model from a Google or Microsoft or OpenAI, and you're not exactly sure what did it get trained on, and oftentimes they're being trained on things like um, guidelines, national guidelines. But this is not how I deliver care. This is not how doctors deliver care. We use the guidelines, but ultimately it comes out of our mouth, our opinions, which are valid to a degree and are informed by evidence, are informed by research, and continuously evolve and adapted to each individual patient. And so this is the approach in healthcare that, to me, I am convinced is really the only way, because why would I ever trust Another medical product from another big box tech company.
Excellent, excellent. Yeah. And I mean, I think that really resonates for the folks in this room. If you're a clinician, if you're a physician, if you're a mid-level provider, in that you can't take that art of medicine, that intuition. I call it my physician spidey sense. Those little hairs on the back of your neck that stand up that tell you that your patient is about to deteriorate and what to do about it. That AI can't necessarily solve, but if we can find a solution that takes the mind of the physician and really helps it develop some of that spidey sense, some of that intuition, some of that critical decision making that comes only with experience and seeing a variety of things. Guidelines are guidelines, right? They're there to help guide us, but they should not be prescriptive as to how we practice and what we do. And, the tools that you're developing are much, and again, scarily sometimes, much more human-like in their characteristics as opposed to, Google, which, you know, no problem with Google. I use it all the time. I used it 15 times before I got into this room, to look up a variety of things, least of which where I'm going to go to dinner tonight. Um, but it's one of those things that black and white picture is something that's very difficult for AI to solve, and I think your approach to it is just absolutely fantastic. I can't wait to see where you go with it for the future, and then utilize it myself. I want to be one of your early adopters. Let's put
I'll
it that
send
way.
you a link.
Yes. So, Lucas,
Yes.
you have a very interesting niche. We talk about, like, and I think I said this on our Zoom call the other day, especially in the surgical services realm, that the surgeon gets what the surgeon wants.
Yes.
In your case, the surgeon doesn't necessarily gets what he needs, not necessarily what he wants all the time. And I know that that's kind of a difficult fine line. And for those of you who are surgeons, I'm not picking on you. It's just what he does. But what I'd like to know is, how do you best help guide those surgical services teams, like to maintain compliance with policy and regulatory, and like what barriers have you had to overcome besides people yelling at you that they're not getting exactly what they want?
um, well, as we know, hospitals are pushing to streamline everything. The problem with Americans in particular is we want individualized healthcare. So how do you create a balance between us, the people, wanting individualized healthcare and hospitals wanting streamlined healthcare? So you have to come to the balance of how can everybody win in a situation, but do it safely. So a lot of times I'm having the conversations with the surgeons that they may want this or they may want that, but is it good for the patient? Is it good for the hospital? If it's a trial, does that patient has that patient consented to have this item tried on them? And I understand that the hospitals have to make those decisions and have to make those, but the patient, a lot of times, someone has to advocate for the patient while they're asleep. So there's a lot that goes on the backside that the patient does not know about, the meetings that has to bring these products in. If it's a specialized surgery, how do we streamline the actual baseline of that, but give that patient the individualized results? I, as a patient, certainly don't want to be treated like the next person because, as my opinion, I would believe that my body could be different. So, how is it that hospitals can bridge the gap between the two? And so, my job is to be cost effective in the hospitals, but make everybody happy. Explain to the surgeons why this is the process, why the patient needs this, and also explain to the patient, these are your choices. You have choice A, which will give you this result, choice B will give you this result, and how can we come to the happy medium? And so, a lot of times those conversations are really difficult to have because someone is going to be mad, but at the end of the day, how can we come to the best conclusion for both the client, the patient, and keep the surgeon satisfied so they can keep booking cases at the hospital? And that's basically what it all boils down to.
When you're the regulatory, boogeyman in the room, and you have to tell people, no, no, you can't. No, this is outside of scope of practice. No, other people can't make decisions for the provider. It's the provider's decision. They need to write the order. They need to do, this and that. No, no, you cannot have this particular device, either because it's not cost effective or because it's is very cost effective, but it's just the wrong device for the patient. Going back to things like hip replacements. I mean, there's dozens of them, and some of them are, good, and some of them are pretty darn scary. So completely understand that you can't be everybody's friend all the time and expect people to really go towards what they need to do regardless of how difficult it is. And sometimes in healthcare, and again, as advocates for these, healthcare systems and for our patients, we have to be the ones to say, no, I'm sorry, no, you can't. I know you don't like it. You can go across the street, but they're probably going to get penalized and they're going to bring you down with them. And so you need to be that person. You need to be kind of that tough guy. So I love it. It's fantastic. And it's really creating more efficient medicine and what's better for the patient. Because let's face it, I've been a patient, you've been a patient, you've been a patient, everybody's been a patient in this room at some point in time. And, we need people like Lucas to fight for us to make sure that everybody's up to date with what they need to do from a policy regulatory standpoint, device management standpoint, surgical standpoint, so that we have the best outcomes. So we're all working on it. Awesome, awesome. And so Dr. Khan, so so let's cut to the chase. So we've already talked about AI a little bit, but I'd really like to see your approach. Like, what is AI doing to healthcare? Is it running it through like a hypercycle? Is it just hype? Is it real? Is it what are your thoughts on AI and where we're taking this in medicine, especially as a hospitalist? I really like to know this because we have to, have our fingers in every single little pot. So
Right, definitely. So we definitely are in hype. I'm not really sure we're in a hype cycle because hype cycle crashes. I think the hype is real. I think this hype is going to be emanating and moving into all spheres, so especially healthcare. And if you look at any projections, there was a projection by the World Economic Forum that by 2030, AI in healthcare will be a market of around $188 billion. So that is huge, and you cannot deny that in a way. So having said that, you have to have real use cases that actually bring value, and that's where people are getting at, and that's where healthcare will be going. And when you look at the future of medicine, AI is going to be part and parcel of it. Let's take a few examples. Um, uh, diagnostics, and that's going to be changing drastically. When DeepMind picked up and tested humans versus AI, it said that DeepMind was actually able to diagnose breast cancer better than physicians, and that was mind blowing a few years ago. Move forward a couple of years, now you know that AI is reading radiographs. They can read thousands in a second, and the radiologist takes couple of minutes, and that helps me out and her out in the hospital when you're looking for that MRI report, and you're not too good at reading MRIs, and you need that report for that patient, and you need that quick. So nowadays, in the future, near future, you're going to have reports generated by AI, and the radiologist is going to just sign off on it, read through it quickly that hey, this is valid. um, Similarly, we had developed a colonoscopy lesion detection, and now the gastroenterologist usually has to go in, take pictures, put it together, put some notes onto it. So we had a program that, okay, you can detect a lesion, it can automatically tell you what it is most of the times, and the gastroenterologist basically signs off or makes some minor adjustments. These are use cases that AI is going to be used for. Then you have drug discovery. Now, you in the past you didn't know what the side effects of that drug would be or the bioavailability would be. Nowadays, you can use AI to do that within days or even sooner. That would have taken months to figure things out. Then, if you look at other aspects of AI, which will help our practice per se, is transcription. And I was on a podcast with a neurologist, and he had a program, Dr. Junaid, Dr. Junaid, I'm forgetting the full name. So he demonstrated during the podcast that I acted as the patient, and he was the physician asking questions. And by the end of the conversation, the note and the plan that was explained to the patient, including all the history taking, all the review systems and everything else, and the physical exam findings were automatically turned into a doctor's note. And we know documentation is a second job for physicians, and you go home sometimes and you have to fill those up later in the day. So So yeah, AI is going to be part and parcel of our practice as we go, and it may mean, and I would like to say, it may mean that we may need fewer radiologists or maybe even fewer hospitalists, and one hospitalist may be able to see many more patients instead of the 20 patients that we are currently set to target. And in the future, somebody like me may be able to see many more patients. So it will have a ripple effect on this whole economy. So yeah, there are many. Yeah, AI is here to stay, and I don't think it's just hype.
Yeah, I mean, certainly creating, increased efficiency in how we practice. Right now, you could see as a hospitalist at least, we'll see, 15 to 22 patients a day, depending on census. And, you might spend 5 or 10 minutes on one patient where you spend an hour and a half on another. So it's really variable. Things are going on, people are crashing and some days you you just don't have time. And one of the burdens on the everyday clinician, physician, so nurses, doctors, apps, is documentation. I mean, it just sops up all of your time, and that's to certainly satisfy the payers needs. You've got to satisfy all of the the guidelines. You've got to satisfy CMS, Joint Commission, all of those things, and make sure that you're still giving the best possible care to your patient. Like it's almost an impossible task. And so, much to your point, utilizing, AI resources, not chat GPT people, using AI resources, intelligent AI resources that help the physician, that help the average clinician, that speed up the process, that take the busy work out of all of the, all of the stuff that we have to, just document forever, you know, can definitely create, significant efficiencies in how we practice medicine. And hopefully, the result of that is spending more time at the bedside with the patient. I mean, that's what we all went to medical school, we went to nursing school, we went to, you know, tech school or, whatever have you. We went into our fields because we wanted to touch people, you know, whether it be physically, whether it be emotionally, whether it be medically, whether it be surgically, all of that stuff. And the current healthcare, especially in the United States, the way that it is, has gotten so redundant and so, prescriptive of how we're supposed to be practicing and what we're supposed to be documenting to satisfy, again, going back to the payer's needs, um, which I'd love to have Brian come up and speak about as well. And, you know, that it sops up your time and you end up spending so much less time with your patient, or you spend as much time as you can with your patient and in the back of your head thinking, I I don't have time to do this. I don't have time to eat. I don't have time to sleep. I don't have time to pee. I don't have time to, hydrate. Goodness, I can't imagine how many people are in kidney failure half the time because we don't have time to even just do things like drink a glass of water in the middle of the day, because the healthcare system has become so taxing and what we have to do in the electronic health record space especially. So having tools like these that speed up the efficiency of providers will not only improve the efficiency, provide hopefully more time at the bedside, but also decrease burnout. I mean, we're dropping healthcare providers like, like lead bricks. And some of these efficiencies, although scary, and we have to learn to utilize them in a very thoughtful manner and in a very responsible manner, with uh, power, what is it? The power is corrupts and something corrupts
Power
absolutely.
corrupts absolutely.
Thank you. Um, Terrible with those things. I shouldn't even say those quotes, especially in front of a large audience. But we
Absolute
have to be
power
very
corrupts.
thoughtful about how we roll out these technologies and make sure that they're not replacing humans, but working with humans to improve the face of our healthcare. So bravo, guys, this is awesome. Um, so I'm going to do a little bit of a round table now, and I'd like to just have I think we have what 10 minutes left in the panel, and I was hoping to give opportunity for people to ask questions if they'd like. But I'd like to just do a quick flash roundtable of kind of your final thoughts. Like, what would you tell the folks in this room, the folks listening, hopefully on the YouTube video, you know, what do you see in the future of healthcare? Where are technologies going, and what you would have to impart to them?
Yeah, yeah. I mean, for me, it is kind of pessimistic as it can sound at times. I'm very positive. So I think conferences like this, bring people together and we can have open dialogue about some of the current issues, but also what are some of the things that can help move us forward, right? educating patients to be self advocates. And, when we are all together, be passionate, take pride in what we do, and let's march on into the future.
So thank you.
I'm gonna say at this point, I think a lot of people have lost trust in doctors, and there needs to be some sort of safeguard implementation on how a client is approached when they're having a problem. And the only way that's going to sort of separate those two, the greed and also um, the individual's health, is to have some sort of buffer in between those two. And AI is going to be a great buffer in regards to having people be more aware of what's going on with themselves. And I just think that people are also just tired of, you know, being used as almost cash, cash ATMs, I should say.
Cha-ching, cha-ching.
Exactly. So I think the transition is going to come a lot sooner than people believe and that are ready for, and I'm hopeful for it.
Awesome. Thank you.
I think the top specialists of any physician field are always going to be the most in demand, and probably in demand in the coming world, not just nationally, but globally. How do I get as many patients and as many women who want the best doctor across the world, that doctor that they want? So to me, this is sort of what I'm looking at into the future is the creation of an ability to have access to nearly unlimited time with the top specialists, because that's the only way to actually scale care with the best care that's out there.
That's fantastic. Thank you. Lucas.
Um, I would say as consumers to all of the medical facilities and products, I say that us as consumers of medical products, we learn how to read our own charts. A lot of times a doctor or a surgeon will come in and say, "Hey, do you have any questions?" Or they will prescribe you something, and you just take them for their word because you really don't know how to read charts. And I've been that patient. I didn't know how to read the charts. I was prescribed something, and later down the line, I realized that I never needed it. So that was one of those times where I lost trust in a facility. But it should have been me that have learned about what am I reading, how to ask those secondary questions that I didn't even know to ask. So when we as consumers start doing that and start demanding that the doctors explain these things to us, go over my chart with me. I learn my chart. I learn how to help you treat me. Then the doctors will be held to a higher standard, and then we will regain the trust in them because now they know that the consumers will know what they need to know, and that will make the hospitals invest in the doctors more. Give them more doctors, give them more time, give them more training, give them more education, and then we'll start seeing healthcare really change.
Fantastic. Thank you, Dr. John.
So yeah, so I'm actually optimistic, and there is a Chinese saying that may you live in interesting times, and actually that was as a curse if I remember correctly, and you can correct me if I'm wrong. We are living through interesting times, and I think these times are going to be positive for the healthcare side of things, positive in better patient care, better patient management, better outcomes, and that's what we are talking about right now. And everybody has their own sort of niche where they want to improve outcomes and improve patient care. I think that's what we're looking for in the future, and I believe we hopefully get there sooner rather than later.
Yeah, absolutely. I think that again, going kind of back to the vision of what we want to achieve in healthcare, it's about improving the quality of care. I mean, we have amazing healthcare in this country, but our outcomes are unfortunately terrible, as compared to even even third world countries. And I think it's folks like my fellow panelists, and hopefully I'll have some influence over that, consulting and advocating with these healthcare systems, and with the leadership in the leadership role that I've come into, where we do have an opportunity to really improve the face of healthcare, increase efficiencies, reduce costs, have better outcomes, and increase the quality of care that we deliver, especially to our patients who we need to keep first and foremost in our minds. So With that, I would really like to thank all of my fellow panelists. You guys are rock stars. I am super happy to get to know you. I am very, very pleased that you're all doing exactly what you're doing in medicine right now, because I think that you are very, very much the emerging face of healthcare and healthcare specialties. And thank you guys very much. I'm going to open it up to questions if anybody has. And thank you all very much for being here with us. Now, I don't see any microphones, but I have a very lovely lady up here with her hand up. Did you guys hear all of that?
Yeah,
Yeah.
that's a tough one. I think one of the things that's hardest in rural communities, I think as you described, and it's also the kinds of patients that you have, um, especially if they're older, especially if they're not tech savvy, much less maybe don't even have internet easily accessible. Um, how do you sort of not allow them to sort of be left behind while the rest of the world is sort of steered in a single direction? I think um, I spend a lot of times in kind of rural and frontier areas of the US where I practice a lot of my medicine, um, and this is a genuine issue. I think there the problems are not necessarily what you necessarily need to solve through AI. I actually think there's a whole different approach to that. Um, but there is a bridge, and that bridge, I think, is maybe through more technology, which I hate to even think about it that way. But ultimately, what those communities need is a lot more humanistic care than technological care. But I, I haven't yet quite solved that one. I don't know if other panelists have some thoughts on that.
I'd love to hear Dr. Khan as well.
Well, yeah, I definitely agree in a way that more technology is always not the best at every solution, but in remote areas, now we are getting to a stage where you may have internets, Starlink, perhaps other companies. Jeff Bezos is doing something similar. So that is going to come to be. And you had a very valid point that people may not know how to use technology, right? And I remember that when we were working on our remote monitoring for COVID-19 patients. So back in the day, they could be elderly; they didn't really know how to use an iPad or something similar, and you knew they will not be using that apparatus and machine. Now, and what we had done was we removed the patient from being able to, actually handle it much. So the doctors, family members, nurses could interact with the patient inside the rooms remotely from wherever they are, without having their much input from the patient, and they would interact as such. And families preferred that with their elderly people who are confused and debilitated. Um, Similar to the network, and is already transmitting. The patient does not need to actually press a button to put the recording in a mobile application. It can be all done remotely. So these things are coming in. Samsung has a ring. There's an Aura ring that is a very well-noted company that can track numerous aspects of the patient's vitals. So um, I think you can definitely find resources that can reach remote areas. And I think here, maybe advancement in technology is actually going to help very soon in the near future. Yes.
And I certainly don't have an answer an all-encompassing answer to that question. That's a very difficult, you know, uh, it's a very difficult problem to solve, right? Um, in the case of the wraparound centers, though, the first thing that comes to mind, at least in my mind, and in a lot of other rural areas, is sometimes leveraging lower level technologies. I mean, almost everybody has a cell phone, not necessarily a smartphone, but they might have a flip phone, a digital phone. So things like bulk, telemedicine, that you could leverage in those centers certainly comes to mind. The patients can't do them in their own home because they don't have access to internet or cable or whatever it is. But utilizing those centers as a median and then cooperating with other centers and other organizations around the United States to provide some of those things like telemedicine services or even just phone consultations, to some of those patients. They might not still be getting the best face-to-face care, but they will be getting some care by hopefully a specialist. And even in larger healthcare systems, I mean, I work in Albuquerque, New Mexico, and half of our hospitals don't have providers. I mean, they have hospitalists, but we don't have ENT, we don't have neuro, we don't have, in some cases, goodness gracious, cardiology. I kind of feel like that should be a basic service for a hospital. And we're leveraging more and more things like phone consultations. We're leveraging email, even on secure HIPAA compliant platforms, and we're leveraging a lot of telemedicine services. So not an all-encompassing solution that also just as I can't remember which one of you had said, that might need a little bit more tech to actually pull off. But I think that finding a fairly simplified solution might be, again, not the full solution to your problem, but at least a help.
I have one comment going away from technology a little bit, and I don't know if this is possible, but one of the things that we sometimes can have a challenge with is getting the typical westernized patient to introduce them into Eastern medicine. We try to do that through a sense of community, and maybe that's something that could help by having an event like such as breath work. We try to regularly do that a couple times a month, or we'll invite some of our rehab patients into breath work. And at the breath work ceremonies, we talk about, what are chakras or what is energy, what is emotional trauma, going through the actual ceremony itself with sound bowls. And then they have the best sleep ever. They're taking less pain meds or they feel a lot better the next day. And now they're introduced to the world of Eastern medicine and it's not as scary. So I think maybe a sense of community, if you can create that, and you really don't need technology for that.
That's a great point.
I want to second Chad. Uh, the future of healthcare needs to combine um, what humanity has learned over the past centuries. And not everything is, of course, perfect, but you weigh and consider what has reliable enough evidence, and you combine all of this for a more holistic management of the patient, and in conjunction with Eastern medicine, allopathic, whichever medicine you want, and combine it all together for a better outcomes.
Couldn't say it better. Thank you very much.
Fantastic. Thank you so much for your time and energy, everybody on that. Wonderful. Now, before we move on, guys, I think it's time to take a much needed 1 minute to get up and stretch. Everybody get up. Let's stretch it out. Right? You all know how important it is not to sit down too long. Keep everything circulating. In the words of the great Taylor Swift, shake it off. Thank you. One person laughed at that too. Thank you. Stretch, stretch, stretch. We have another two panels or one panel, and then we have our awards, and then we have cocktail hour. What's Las Vegas without cocktails, right? So still so much great things coming your way before the end of the day. All right, one final stretch, 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 and then please take your seats so we can keep this party going. Okay, thank you so much for taking your seats. And I promise, guys, you're going to have plenty of time to connect and network over cocktail hour and, of course, in the coming days ahead. So thank you so much for your cooperation. Let's shift now our focus to a deeply impactful session titled Science, Tech, and Willpower. Time to go beyond the surface to treat addiction. And of course, all of us know at least one person who has battled addiction. So this is going to be a very important and insightful panel coming up here. This conversation goes beyond the usual, touching the very heart of what it means to seek and provide help. They'll explore compassionate, innovative approaches that consider the whole person, addressing not just the symptoms, but the underlying causes of addiction. Again, friends, please sit down. Let's show each other respect as we have new experts coming to the stage. I promise you will have plenty of time to network and chat. If you can please take the stage, let's give each other some respect and kindness. As of course, when you're up here, we're going to want everybody to do the same. So thank you so much. Thank you. Yes. All right. Everybody sit down, except for our panels. Okay, now without further ado, let's welcome our moderator, Leslie Chen, founder and CEO of Pegasus Rising LLC, and our esteemed panelists. Come on up, guys. Thanks for being here. All right. There's that one.
Thank you for the introduction. All right, so it's a challenging time of the day. I hope everybody is still awake. So when I saw our topic, I was actually quite excited. I think in the past few hours, people have been talking about like infrastructure, system, and data and processes, and we're going to talk about addiction. And the difference is that this is to a lot of people, it's a highly personal topic that is not quite talked much. However, the treatment, the solution is always elusive as well. Now, we have an amazing panel here because each of us really come from a different perspective using different tools and background to solve this common problem. Now, let me introduce myself first. My name is Leslie Chen. I am the founder and CEO of Pegasus Rising LLC. And for the past 9 years, I have been helping people, especially women, overcome the toxic relationship with food and food addiction. All right. So it all started from myself gaining 50 pounds. During the first year, moving from China to the United States, not knowing what I did, but at the time, when I was doing a lot of diets, I developed the food addiction. A lot of people develop food addiction, pretty much the same pathway that I had. When I started Pegasus Rising, I wanted to solve this problem. It's because it really matters. First of all, it is a problem with really high prevalence nowadays in a society. Two is that the damage is huge. Like on an individual level, I've spoken to 6,000 women in the past 9 years. Now, most of them that I've spoken with who have the problem are spending 3 to 4 hours per day thinking about food. 3 to 4 hours of waking hours during the day. Now, on the company level, we have statistics showing that corporations in America each year are losing $400 billion because of not only the food issue, but also one of these consequences, which is a weight problem due to absenteeism. So I want to solve the problem. That's basically my why. Now, I'm going to pass it on to our great panelists here to let them introduce themselves. Now, first person is Ryan.
Hello, everyone. I'm Ryan Walcott. I'm the founder and CEO of Meridian Diagnostics. I'm based out in Atlanta, Georgia, but my laboratory is actually up in Colorado Springs. So we service not just the toxicology space, but also a lot of long-term care physicians throughout the United States. So by targeting long-term care physicians, we go after the UTI business, onychomycosis, which is nail fungus, and also wound care. That's one side of our organization. Now, the second half of our organization kind of aligns with what this whole panel is about, and that's the whole addiction treatment portion. So one of our business aspirations and continuations that we're going to keep focusing on is drug treatment, right? So drug screens and drug confirmations through use of a variety of technologies. But that's who we are. That's what we do, and we're here to partner with a lot of healthcare organizations and physicians and help them provide the best patient care and treatment for their physicians and staff as well as their patients.
My name is Jeff Kraber, president of JBack Consulting. I've been in this space for a little over 10 years. We are primarily in the IT space with my background, which I won't go overly in depth with you on, but has generally led our organization into the healthcare space. So, with that, we've been really working with regenerative healthcare, wellness options, prescription drug management, and monitoring. So I think, just like everybody else in this room, has had somebody close to them that has maybe led them into a scenario where this is something that's close to you. So I think with that, we've naturally and progressively ran our technology into the healthcare space, and I've been really continuing to drive that forward.
Hi, I'm Brian Bauer. I'm the founder and executive director of the Abundance Foundation. We're a nonprofit based in Fort Collins, Colorado. We're working on bridging the gap in the current addiction treatment model, where the highest relapse and recidivism rates are. So we're doing that by utilizing the lived experience of our team of recovery coaches. So we're all in recovery ourselves. And we're using that to connect people to sober community where we do healthy, fun activities, try and give people like a sense of belonging and community, a sense of purpose and hope again. We do things like bowling and laser tag and camping trips and tubing and all things that when people are coming out of addiction that they feel like they're never going to be able to do in a fun capacity again. We're also then providing safe, stable, affordable, sober housing, employment opportunities, and thank you, and life skills. So, when somebody's coming out of jail and prison or detox and their entire family system for generations, a lot of times has been based in not having any life skills on how to manage. It's one thing to tell somebody how to go get a job. It's another thing to not have any concept of what a resume even looks like. So it's we're doing that, and we started it 2 years ago. It's only for Medicaid clients right now. We don't have any major insurance providers that recognize recovery coaching and peer services as a legitimate service yet. So we're doing it for all underserved populations right now, and we're having a lot of fun doing it. That's the main part of it. So thanks.
All right, so guys, we're dealing with addiction here. It's not like a system where you can put some coding in it and something can be fixed right away. Addiction is a highly elusive and volatile issue the person has to deal with a lot, like internal stuff. And people who help them have to face a lot of barriers as well. Sometimes it's stigma, sometimes it's a community barrier or lack of infrastructure. So my biggest curiosity for you guys is what has been the biggest barrier for you in terms of performing your mission?
That's a great question, Leslie. So obviously, being in the independent laboratory space, we're competing against some large laboratories who I'm not going to name, right? But they're kind of the big two. The big two, if you had to imagine any laboratory, a lot of your physicians by default may use them because they may be unknowing about the benefits of using a smaller independent laboratory. So one of the larger challenges that we face is obviously now in terms of payer mix, right? So as Brian mentioned, when you're a smaller organization, you're not necessarily getting a lot of those larger contracts like the Aetnas, the Blue Cross Blue Shields, the Humanas out there. You might get a PPO plan, right? But you may not get the HMO plan. So what I'm seeing a lot, especially with some of the drug rehabilitation centers and medically assisted treatment programs that we're assisting right now, is that we have to target I would say more rural areas, right, where we see a little bit more Medicaid in terms of payer mix in the rural areas. But obviously, with that, now you're kind of excluding others, right? And the last thing you want to do when you're, treating somebody for addiction or any issue in reality is make them feel like okay, they have limitations into who or where they can go to for their treatment, right? So obviously, when you're in a position and only certain labs are favorable for certain payers, you kind of then have to segment out, okay, who your target demographic is, because at the end of the day, we want to support everybody, put patient care first, and make sure that we can put everyone in the best position to succeed.
Thank you so much. I think we're talking about resources stretched really thin and probably not evenly distributed around the nation. Great job, Jeff.
Yeah, so from my point of view, it's a little different, sitting between Ryan and Brian and with Leslie here, it's we're kind of leaned on a different sense of, how can we progress forward? How can we be preventative as opposed to reactive? And not all environments are identical. And so, if Ryan's lab says, hey, we talked to Brian's organization and they're utilizing XYZ, how can we implement that into our space? It's not that easy. And so that's where we need to come in from a consultative approach to bring in a mixture of technologies that can help, so we can't always just rely on one technology to help what we're trying to accomplish, because that also mixes in with what the organization's drive and goal and overall mission is. And so there's a lot of things that overstep boundaries, whether it be AI. I know that's been a lot talked about over the days in the previous years. So you look at it, what AI is doing, and I think a good understanding of that is what's being put into it. Is it good in, good out? Is it bad in, bad out? And so you start to have to leverage tools that maybe that organization wants to see, or you start to understand, is it from the organization standpoint, the healthcare system standpoint, or are we looking at it from the patient standpoint? Because those are two very different vision points. And so we have really worked together across a lot of different organizations across the healthcare sector. I think even getting into other verticals that can be kind of an outside perspective looking into this and really monitoring, whether that PDMPs and how they integrate in with the EHR is actually a progressive movement, or are we just kind of checking a box from a compliance standpoint? So are we doing a follow through? Are we doing additional education on that and following up with those findings that we're coming up with? Because if we're not, we're really falling short of what we're trying to accomplish at the end of the day. So as fast and as knowledgeably as we can be is great, but with the ever-changing dynamics of everything we're going through, it's as soon as you feel like you get through one hurdle or over one hurdle, you have a twice as big of a wall right in front of you. So we're continuously trying to drive to find that education, to keep in front of that education and deliver that technology for how we can start to do some preventative measures as opposed to consistently being reactive.
Love the different angle because we're talking about preventing things before they actually happen instead of the more of the passive solution. All right, Brian.
The the current the current model of addiction treatment doesn't work. What we've been doing for the last 3, 4, 5, 10 generations doesn't work. 30-day programs don't work. 60 days, 90 days, it doesn't work. So we've been able to throw all this new medication and technology and all these other things at addiction treatment, and the foundational way of doing it is off. And because of that, no matter how much we've been able to do technologically and everything else and medically, we're not solving the problem. And by not solving the problem, we're increasing the stigma because people stay stuck in the system. So when you see somebody go to 8 or 9 or 10 or 12 treatment centers and their Medicaid or their insurance or their family is paying over and over again, clearly the system is broken. So what we're doing is having to fill that gap, and in filling that gap, we can't do it by ourselves. So the biggest struggle that we've had, and we're actually collaborating really well actually in Larimer County right now. We actually have a good amount of support in the county. And somebody had brought it up earlier with the wraparound services, is getting everybody on the same page. So Department of Corrections on the same page as human services, as child services, as the city council, getting everybody and the detox centers and treatment centers all collaborating and communicating amongst each other so that there's never not a warm handoff between levels of care. The gaps in the system are where the relapse and recidivism rates are. Right? When somebody gets out of jail or they get out of prison and they have a felony, they don't have a job, they don't have any money, they don't have a place to stay, and they can't get any of those things because of the situation that they got out of. But they do know how they can get money, they do know where they can stay, and they do know what they have to do to survive. That repeats the cycle, right? So all it takes is a person in that gap period that's getting them to the right next stage of the process. And the thing about the process is it's not a 30-day process. It's not 60. It's like a year, 2 years before somebody's fully self-sufficient. And if you live in a place like we're at in Fort Collins, where the cost of living is one of the highest places in the country, and you're getting out, I, I'm the founder and executive director of this foundation, and the cost of living is high for me being in this position. So when somebody's getting out with nothing, it's incredibly difficult. And so in the process of doing that, it's getting everybody on the same page and really organizing community-centered events and teams. And there's some teams that are starting to develop up there right now that are setting the standard of what is going to be duplicatable in the process of that. But it really just takes time. And so it's having the patience to kind of withstand the process of things taking time to develop. But having the community support is the other big thing, ending the stigma of it, having discussions about it. A lot of people, I would imagine that most people in this room either know somebody, a friend, family member, coworker, somebody that's been affected by addiction, and nobody talks about it. Most families, it's the family secret, and nobody wants to discuss it, and nobody wants to acknowledge that exists, but everybody's gone through it. And so the more that people are open to talking about it, I know that one thing that's been really big for us is this idea of, we hashtag it all the time, of recover out loud. Tell everybody about it. We have this thing like remain anonymous. You don't want people to know. And like, yeah, I'm going to protect people's anonymity in the 12-step community, but I'm not going to be anonymous about mine, right? I've been sober for going on 12 years of my own sobriety. And so I have this team of recovery coaches and myself, and we're all former addicts, alcoholics, criminals from these really dark backgrounds, but we have the lived experience to go back into the darkness to pull people out. So that's the answer.
That's a really big answer as well. And let me just wrap it up. We're talking about shortage of potentially resources, shortage of funding, shortage of sometimes probably government and community support, and shortages of confidence in these people's ability and not confidence in solving the problems because of the stigma and not talking about it. I mean, I'm in the area of helping people overcome food addiction. I definitely see that a lot. A lot of women I work with, like they're smart, they're really well educated, they are good at following, let's say, disciplines and rules and researching information, but they're not able to do it because, first of all, there is a lot of stigma. They don't talk about it, they don't get support. But the other thing is really that I do agree with what Brian just said. The current model of fixing addiction does not work. Like, for example, if any of you have been struggling with the emotional eating problem or the, let's say, toxic relationship with food, you probably are really good at researching and learning information. I've got clients who have like read and memorized nutrition textbooks and trying to like just behave, but they cannot. It's not a lack of information problem, but we're all stressing out. Oh, you got to do the right thing. You got to get the right information, let alone all the misinformation right there. It's also not a willpower problem because there's something that's going way under the water that is sending those people a lot of triggers to make them do this and that even they themselves cannot control it. So I'm really fascinated by what Brian has been doing, like his venture and mission, because we see the alignment in what we're doing, and you're definitely spearheading this thing. And not you, like for me, it's a team of me and neuroscientists and support. For you, it's like you're trying to mobilize the entire community. How does it feel so far? Seriously, I'm just curious.
I'll give it right back.
That wasn't a rhetorical question. It's so I mean I worked in the I got my qualifications for counseling and whatnot by working in the treatment industry for a number of years before I started this, and then my personal journey. Um, so it feels unreal at a lot of times. It's because of how quickly it moves. Like I knew that there was this need there, and I was trying to, in starting it, I was trying to find somebody to model it after. Like anytime you start a business, like you can go, if you want to start a shoe business, go find the guy that's the best at selling shoes. There was nobody doing this model. And and in my own personal journey of it, I was taken in by this group of men early in my recovery process who not just showed me how to stay sober, but they showed me how to put together a life and be a man. They showed me how to grow up. They showed me how to not act like a child, and really take responsibility and accountability for my actions. And in doing that, we also had a lot of fun. They took me out to go play golf. We went to the gym and we went to church and we did these different Bible study groups and all these different things where I put together this life. And and so I just modeled it on that, and made it a requirement for people to get money. And I guess when you give away free money, people when you give away free stuff, people tend to want to be part of what you're doing. So we use grant the way it works. We use grant funding to scholarship people into our sober living houses, and then do it on a sliding scale basis so they get to a point of self-sufficiency by the time that they're out of our sober living where they can afford to pay rent on their own. Um, and so when we're, running dinners and events and giving away free money, people like that stuff.
Love it. I really love it. Thank you. And now I do have a follow-up question. There's a lot of people have been through this stage where they're addicted to something, and it's been such a long time they have to battle against it. Um, they sometimes hear the voice within them, like he has fixed it, he's able to fix it, but it doesn't mean that I can, even though I'm following the same model. I wonder what your opinions are.
I'm sorry. Can you repeat that question again?
Right.
Yeah.
So we're talking about people around us who have
Yeah.
certain kind of addiction, right? My bad. This is kind of like a prompt question, unexpected, but um, they're looking at the successful examples, like somebody who has recovered from it, right? They're like, he's able to do it, but that same method might not work for me. I'm just curious what you guys think about it. And if you have a friend who is struggling with this problem and this kind of thinking, what would you say to him?
That's actually a really great question, Leslie. So I can use that question to kind of backtrack into, I guess, my own personal story and how my wife and I got into this whole business, right? So obviously, I have a strong background in laboratories. Started environmental science, pivoted over to diagnostic testing, and obviously, throughout time, you start to develop a good passion for what you're doing, right? Everything that I'm sure everyone in this room can share a similar story, right? We may tend to take things a little seriously, but we're focused. We got a mission in front of us. So by having that mission, by having that focus, I was able to grow through the ranks within my organization. And my wife and I, who's actually over here, she's also my business partner and managing partner for our consultation firm. We had a third partner, right? There was three of us, not two. There was three. And it's one of those things where you get somebody that's close to you, you build up a work relationship with them, then obviously that relationship turns into a friendship. But for whatever reason, the conversations, even though we had friendly conversations and we had work related conversations, I never really took the time to really ask him, hey, are you okay? Right? I would ask my wife, hey, he seems a little weird today. Something seems a little off. Maybe we should check in on him. But unfortunately, we didn't, right? So it's and that story kind of progresses to where he didn't show up to work a week before we were all supposed to move together, the three of us, from Miami up to Charlotte to open up a laboratory. He did not show up to work. I was close enough with him to reach out to his girlfriend. I'm like, hey, where's his name's Chris. Well, where's Chris? He's not at work today. It's about 11 o'clock. He's usually early. He's the first one in the lab, right? And then she's like, "Oh, that's weird. I thought he was at work." Well, obviously that leads to a string of phone calls, right? You start calling family members, you start calling other friends, and then they found him unfortunately passed away, with a needle in his arm behind a KFC in Pompano Beach, Florida, right? So now I'm looking at Sam, my wife, and I'm like, "Man, I really wish the week before I would have asked Chris, hey, how are you feeling today? You seem a little off. You seem a little tired. It's been 3 days in a row, and you look like you haven't slept. You're like you haven't slept a single hour." So it's one of those things where even though, and I know your question was, okay, how can we find that within ourselves? Obviously, within ourselves, you got to be real with yourself, right? You kind of know if you're slacking off, if you're going a little extra hard. I know we're all in Vegas, right? But let's not go too hard tonight and tomorrow. We got to come back over here. But you got to have that real conversation with yourself. And also, accountability. Hold the people around you accountable, right? If you see, and somebody had a speech earlier on, right? She's a part of a different group, but she says, ask the person next to you, if you see somebody and they're maybe sitting by themselves, for lunch, or you're going out afterwards and you see somebody from the conference and you know that they were there by themselves. Maybe, hey, how are you doing today? Have maybe a bite with them. Just check in on the people around you, and also make sure you have that internal check in with yourself from time to time.
I love it. And thank you for sharing that story. A lot of time we might feel that, oh, I don't know that person well enough to probe. But sometimes you never know whether this is going to be the last day he is at work, right? Sometimes there's a sense of obligation if you think in that way, and you just have to reach out and show the cariness. All right, Jeff.
Yeah, I think Ryan said it really well. Brian's expressed it very well. Is at the same time, I think accountability and community are really the two biggest impacts you can potentially have for this. Not myself, but very close family member and members, friends, people just in my community. I think we have all had it impact our lives very closely. And so within yourself, I think hard for me to describe because I haven't been the living member of it, but I have had, immediate family members have gone through it, are going through it. So I think it's something from an accountability standpoint on the self, but it also, just like he was expressing, it's up to us as a community to reach out to those around us. And like Leslie was just saying, it might not be inner probing and really getting to the bottom of it, but just simply asking how you're doing may trigger something in that moment. You don't ever really know until you do it. So without doing it, you'll never know. Uh, and I think overall, uh, community outside of the accountability are the two main pieces for me.
I think it's really about meeting people where they're at. So whatever stage they're at, you're just meeting them where they're at. And they just need to know that if you're a friend, family member, somebody that cares about them, that you're there when they're ready for it. That you're not going to try and push them, you're not going to judge them for it, that you're just there to help them when they're ready, when their time is ready. Now, for people with us that come to us and they're, kind of still on the fence, um, there's usually a light switch moment for most people. And it's not some significant, drastic change. It's something like I had a woman. So when we first started, it was myself and one other woman in Fort Collins, and we had this like fold out white table that we were running the business off of. And we were the ones driving to sober livings and picking people up and shuttling them around to doctor appointments and all that. And so I pick up this woman who had just been released from jail and had gone through treatment centers multiple times. And she had to sign up for community service hours. So we go to the community service office. She had one of the two forms that she needed when she started filling out paperwork. And she's like, I can't do this. I'm out of here. She gets up, throws the stuff, starts walking out the door. I was like, wait, we'll just go up the street. We'll get the form, we'll come back. So we drive up the street to the DHS office, get the form, come back. She fills it out, signs all that stuff. The next couple of days after that, she scheduled her own doctor appointments. She made it to those doctor appointments. She met with her probation officer. It was in that moment that she realized that she had the capacity to do it. And so it's not these and on the flip side of that, that's where the relapse and recidivism time is too. It's not some drastic event. It's not the loss of life for a family member or friends or getting fired from a job. It's like these small things. That's like my boss yelled at me today, and then they go off the rails. And so, but there's the same light switch moment that comes along, and all our job has been doing in this is keeping people immersed in the community and exposed to the way of life long enough that it clicks. Right? It's the same way that if you're in a negative environment for your whole life and you're raised in an abusive household and all of these things, and that's your way of life, you're naturally going to become that way most times. Some people have the opposite effect to make it out of that, but most times it becomes that. In the same way, we just immerse somebody in a new environment and keep them in that bubble long enough where it doesn't even seem where they have to actually try to go back to the old way of life, where they're like they can be on the fence all they want to, and then as soon as they're like around it long enough, all of a sudden they just show up. They're like, I wasn't even trying to come here tonight, but I just came. The same way that they would just, like I was an alcoholic that would just somehow I just ended up at the liquor store every day after work or before work or during work, however it played out. But either way, that's my car just had this GPS to go right there. But the same thing applies on the good side, right? The same way applies. We can flip that coin over and we can apply the same set of skills and the same habit forming abilities to the positive things. And so it's just being around somebody long enough to get them to that point where all of a sudden, and I never know what it is. Like I never know exactly who, I don't have a way to pick who's going to make it and who's not. I just know what works the majority of the time.
I love it. And I want to add to it. Brian, when you were talking about you drove her around that story, that client or patient, well, when you drove her around and getting the paperwork down, you know what she might be thinking at that time is that, wow, he really has faith in me. Sometimes people in that situation for a long time, they've lost trust and faith and belief in themselves. And when you tell them that you can do it, that words alone can be so dry. But when you're actually taking action, like holding his hand and going through all the steps one after another, they can be really touched and even sometimes surprised within saying that, well, somebody actually have that kind of faith in me. Then what is stopping me from believing in myself? And I think that move along is really powerful. So I actually do have an invitation for you guys. When you go home, think about some friend or colleagues or maybe family member who might be struggling and just send her a note or him or her a note expressing that you actually believe, you actually have faith in him. For me, my favorite way of showing people hope, just lighting up their day, is driving to the Starbucks drive-through, and I asked the cashier what did the person behind me order, and I said I pay for him. And then sometimes I will park somewhere and I'm just gonna observe that person's like expression on her face. And that can make my day as well. But hey, you never know. That person might be going through something really awful on that day. And you know what is the side benefit of that? Ever since I did that, the first time was in 2020. Ever since I did that, there have been multiple times when people were treating me like the universe is like working its way, like in rewarding you in multiplied amounts. So that is also amazing. Now, my next question for you guys. Right now, what is your biggest way of contributing to the community? I'm not just talking about community, or also the organization you're working with, the industry you're in. What is your big mission in serving from this perspective?
So Meridian Diagnostics, the way we contribute to, our corporate partners, in society is obviously by providing laboratory services, right? So for any one of our providers or healthcare facilities out there to feel confident in their ability to treat their patients, right? To be able to treat anybody who's in recovery, or if it's on our elderly side, if they're doing any sort of molecular testing. Obviously, we got to make sure that our instruments are up to par, right? So we want to make sure that we're extremely innovative. So I know now everyone's talking about AI, but on the laboratory side of things, it goes a lot deeper than just the intelligence and then the artificial intelligence options out there. It actually goes into how well your instruments perform, right? So we all know from the toxicology space and the addiction treatment space, you got your point of care cups, which kind of provides you that first level of drug screening, if you want to call it, right? Some of the instruments that we use, they can get pretty pricey up there, right? But they're much needed, so we can provide the best results, right? So we got some chemistry analyzers that can then provide you even better drug screens, right? Test for a little bit more substances in there. And then we always make sure that we keep our, it's called LCMS, right? It's liquid chromatography mass spectrometry or spectrometers. And basically what it is, it's a really high tech tool, right? We can tell you exactly how many nanograms per microliter of a certain substance are in a patient's, urine specimen. And then from there, obviously the healthcare providers can then go on and provide the better treatment options, right? So we can look at the analytes, the metabolites, if somebody says they're on something, okay, and then they, because then sometimes you have to do medication monitoring as well. So it's not just people that are in addiction treatment, but sometimes it may be pain, pain medication management, things of that nature. So by always staying innovative and staying, I would say, ahead of the game, right? You don't want to be using technology, especially in the healthcare space that was, relevant, in 1999 or something like that, right? We're in 2024. I see it a lot of times. A lot of laboratories are using some technology that was developed in the 1980s, right? Because somebody was in that system, somebody was in that field for a long time, and because there is so much, processes or change management processes that have to take place for anything to get updated or upgraded in a laboratory, which goes down to validations and experiments and things of that nature. But it's worth the cost. You want to make sure you put, all your clients, your healthcare providers, in the best, scenario to treat their patients and provide the best healthcare.
Wonderful. And can I just ask, out of curiosity, who are your customers?
So when it comes to toxicology drug testing, most of our customers are medically assisted treatment centers. We do a lot of partnerships with drug rehabilitation centers nationwide, right? So with the exception of California and New York, because they got some really tight rules and regulations in those states. But that's for our toxicology side of our business. That's our target customer. Then for the molecular side, we usually tend to go after a lot of long-term care physicians because we can provide some really accurate, fast turnaround time. We get those results out within 24 to 48 hours. You don't have to wait a week with us.
Thank you, Jeff.
Yeah, so I think from our organization being named JBAC Consulting, a consultative approach to whatever company, hospital, clinic is coming to us for, we need to have a good breadth of knowledge in order to provide a good service to what they're looking for. And so it really is on us to provide that to them. So when organizations maybe don't have the funding, don't have the bandwidth or resources to go out and really get to the bottom of what they're looking for to get them across the finish line to support their mission, that allows us to be able to come in, step in, and really take our knowledge that we've gained from other customers, whether it be state, local, county hospitals, regenerative health organizations, and really start to pool those types of resources together to make sure that we can lay options out on the table. And a lot of them initially aren't, or they're either very cost effective and then become not cost effective, or vice versa. So we can really start to understand what type of processes of implementation can go into it, and so they don't get stuck or they don't feel like this is the first time they've ever done it. And so to be able to reduce that weight up front really helps them run it out in the long run.
So you're basically doing the heavy lifting on your side so that they can have a more efficient and smooth journey.
Absolutely. And our customers do a lot of it as well with the feedback that we get from them. So able to pass that along.
Thank you.
So if we take the humanities side out of it and just talk about the societal benefit, corporate benefit, corporate partners, the addiction epidemic in America costs the US $740 billion annually in loss of productivity, healthcare, and crime. That's billion with a B, which is a significant amount of money to be lost every year. With the success rates that we have right now, we could probably clear out, if we scaled this to what we're doing nationally, which is ultimately the plan to blueprint this and duplicate it, we could clear $500 billion of that. So the idea that a rising tide lifts all ships is the idea. So we're working with getting local corporate partners and philanthropists on board right now, putting together advisory boards and that type of thing for additional fundraising. But if corporate partners really start to see how we can meet their philanthropic needs, and they can be supporting something that ultimately also increases their business because the economy rises with it as well. The benefit is to everybody. The local societal benefit is taking the strain off of the systems that exist. The systems are overloaded. The ERs are overloaded. The detox centers are overloaded. The police and firefighters and paramedics are overloaded. And it's because of the repetition, right? Like we have 10 people that relapse regularly every week and need to be seen. With the way that the fentanyl crisis is and whatnot, then there's a new 10 the next week, and then there's a new 10. And so if the same 10 are repeating and then the same 20 are repeating, we're not getting anywhere. And so as soon as we can get it to where it's manageable, there's enough resources to go around. People think it's like there's this massive shortage of resources, and there's not. The system is just overloaded for the resources that are available. And if we don't put a strain on those continually and do this, a lot of these preventive measures that have been talked about, that's the next stage of this, is really to, okay, how do we get this next generation of people to not want to do it, to not want to be involved in the process at all. You know, there's not this period in time anymore of people getting to experiment with drugs. I don't know about anybody else, but like I went through a period of being able to experiment. There's no more of that. And so how do you communicate to a 14-year-old, 13-year-old, 12-year-old that like you don't get to experiment with drugs anymore because one time means that you die? And so like this term of overdose, I have another friend of mine in California who uses the term poisoning and not overdose, because overdose implies that there is a safe amount to be able to use, and there's not. There's not a safe amount of anything to be able to use anymore. And so it's changing the wording, it's changing the culture. But in the end of that, like the entire society comes up, but it's really changing how the culture of people are in general. And we can do that. I mean, the data that we have shows that we can do it. So
Thank you. And we have about 5 minutes. I have one last question for you guys. Okay. What kind of innovation do you think right now is most needed for the type of work and the contribution you are doing right now for the society?
Yeah, I'll keep my answer short. I mean, basically, when it comes down to innovation, it's kind of what I touched on my last, segment over there. Any innovation that can give anybody faster turnaround time and more accurate results is going to be a home run hit, right? When you want to, I'm talking about from a laboratory perspective, right? When you want to compete against other laboratories, we want our providers to provide the best patient care. Everybody does not want to wait, 2 weeks for a result, right? You don't want to have to question if the results you're getting are accurate, or if you need to retest or give somebody any false information, because sometimes that false information or false result can actually lead to someone's livelihood, right? It can either result in death. So we're not playing little games over here, we're playing big boy games, right? Or it can result in somebody getting a sentence to prison, right? So you cannot play around. You have to take your innovation, take your technology, take your experiments as seriously as they come. So by staying ahead of the game, staying on top of the news, the breaking, the upcoming technologies, we're able to just continue just to put innovation at the forefront.
Yeah, I think this is a tough question a little bit. As you look at, like, Michael Koch was just up here talking about implanting chips and creating ways to measure and dictate like how things are going. Not saying that that is the way to go, but again, to wrap back around from what we were talking about earlier, it's finding a way to advance accountability and being able to make it to where something's not hidden forever. You talked about it where it's something people don't like talking about, but at the same time, if it's not being talked about, it's not being heard or solved. And so, without knowing that, having transparency and accountability into some sort of technology, uh, if I had the answer to it, uh, I'd maybe still be sitting here, but maybe not. I think that's a key piece to what we need to move forward.
So we use, I mean, I talked against technology a little bit earlier, but we do use AI technology in a lot of our treatment planning and documentation, which has been super helpful. Cuts out a lot of hours in the week that we spend documenting and not treating people. So um, that's made a huge difference. We also use technology as far as apps goes for client accountability, checking in and out of houses and that type of thing. So the technology aspect has been beneficial to us. And I know that a lot of technology has evolved since COVID and people were forced kind of to pivot in that direction. Um, but what needs to happen and will always need to happen is people helping people in person. One person helping another person face to face, one on one. Like nothing is ever going to replace that. And and in that we start to get to the roots of where people's pain points are, where their trauma is, and addiction, no matter if it's drugs, alcohol, food, whatever it is across the board. People are addicted to all kinds of different things. I would imagine that there's a good amount of people in here that have probably been on Facebook at some point during this talk. So if that if that shows what addiction is, there you go. You just weren't chugging Jack Daniels in here, but but yeah, so I mean, there's going to be innovations, and the technology is always super helpful to us. I know that there's a lot of different platforms for AI in terms of meeting people's needs for services, and I think that's a good way to increase communication. The more that we can communicate and use that as a tool and a resource, it's gonna evolve into being able to use both.
So much, guys. Done a great job. And unfortunately, we don't have time for FAQ, but if you guys have any questions regarding anything relevant to what we talked about, feel free to reach out individually. Thank you so much.
Thank you. Great job. Great job, guys. Thank you so much for sharing all of your thoughts on that. Now, moving right along to our last panel, and then we have our rewards award show, and then, of course, networking cocktail hour. So I believe we can all agree that mental health is a topic of paramount importance, yet for men, it often remains unspoken. This is going to be a really interesting panel. Societal norms and stigmas can prevent open conversations, leading to hidden struggles that need to be brought to light. Today, we're breaking the silence and setting the stage for a transformative talk. Our next panel brings together voices from various walks of life to unravel the complexities of mental health among men. Let's welcome our session's moderator, Anthony J. Nelson, founder and managing partner at Growth Culture, and our esteemed panelists. They are going to shed light on this crucial topic. Let's talk about mental health and men and encourage some open dialogues for well-being. Round of applause.
Thank you. Okay. At the end of the day, does anybody have any energy left?
No.
I'm sure.
No.
No.
I see two people in the crowd that may boo me once or twice. Craig, Brandon. Um, Thrilled to be here. I know it's the end of the day. I know it's generally when people run out of energy. We had all of our carbs at lunch and run out of, wanting to stay through these panels. But I'm pretty excited about this one because I think of in business, in healthcare, everything that we do, diversity of thought is very, very important. Whether it's men's mental health, women's mental health, or anything in between, the panel that we have here is quite inspiring, I think, because we have some business minds, we have some clinicians, we have some investors, and the like. So we're excited to be here. I'm Anthony, founded Growth Culture, really on the foundation of after spending a ton of time in healthcare SaaS companies, saw an opportunity to come out and actually figure out how to help other healthcare entities scale earlier on. Because when these companies are doing really, really well, that means we're expanding access to care, we're improving the well-being of providers. Even though payers aren't always the people that we like to talk about, we do need them to be doing things as well too. So my whole goal is to make sure that we have a very good ecosystem of solutions like Craig's out in the market, to make sure that we're supporting people. So I'll turn it over to the rest of the crew because we have some really dynamic backgrounds here, and I'll let you guys introduce yourselves, and then we'll get into it.
Sure. So my name is Cassandra Ruella. I'm a licensed professional counselor by trade, and I'm the executive director of Paramount Wellness Retreat, which is a detox and rehabilitation center for substance use. But my background previous to that was about 10 years parallel to the Department of Corrections, which is very heightened in male clients. So that's why this was very important to me.
Hi all, my name is Gaurav Bhandari. I work with Leon Capital Partners. We invest and operate in healthcare companies with a very strong focus on access and quality of care. Um, one of our operating companies is in mental health space. It's called Turnwell Mental Health Network. We have around 80 professionals, 80 providers there on our platform working in 8 states. Um, and yeah, I'm so very happy to be here with everyone and have a good discussion here with about accessibility and the quality of service to the patients right now.
Hi, my name is Ronita Boat, and I'm an entrepreneur, patient advocate, certified peer counselor, published author, and I'm also the founder and executive director of Caring with Compassion Community, which is a peer-run organization where we support those with lived experience, whether it's mental health, substance use, co-occurring disorders, and traumatic experiences. So we help those individuals along on a recovery journey and getting back into health and wellness with living life skills, vocational training, and supporting with job development as peer certified peer counselors themselves with their lived experience.
Hi, I'm Valentino Matlock, and I'm a certified dementia practitioner, and I'm the head of marketing for Montclair Senior Living and Memory Care in Morton Grove. We actually are a new luxury brand of assisted living. We saw a need for affordability in the Illinois market. So we were, as investors, we were able to open up a new community, which will be open in May, that's catered to affordability. And one reason I am in health, in this panel is because I dealt with a really bad situation when COVID happened. My former owner of our company committed suicide at our office during COVID. So, there were signs there that I saw that I wasn't able, I didn't know it until now. And so if I've known those signs, I would have been able to help them.
Love it. So we're going to try to keep this actually to about like 20, 25 minutes so we can actually get some people off to whatever you want to do or even welcome some questions. But I figure we start with my background with mental health is I'm in remission from PTSD. Had a health experience, thought I had a heart attack out on a run. That was kind of diagnosed as you thought you had an event that you thought you were going to die. Diagnosed with PTSD. So for me, it was really about like, how do we get access to care? How do we get people going through care? How do we get people supported on the back end for care? So as a panel, we decided we weren't going to talk about the stigma of men's mental health because we've talked about that enough, but we want to talk about how do we improve access? How do we make sure that people that are actually in care get through care? And then long term, how do we support them so that they remain in remission or even the family members associated with it? So I figured, Cassandra, you've got some very unique perspectives on access, and that's not just saying like, hey, how do clinicians have more appointments, but you have this really cool perspective on kind of the dynamic of the people that are in the market right now.
Yeah, so I think that as a clinician by trade, again, like we're in a rehab center and I'm in the for-profit sector, but previous to that, I was with Department of Corrections, which is, 85% male when you look at the entirety of the population in DOC. And all of that, if you're meeting the substance use disorder diagnosis and the need for treatment, the court and the judicial system will literally force you to go. It will be a requirement of your parole or your probation or your release from incarceration. And there are so many studies that identify that forced treatment not only doesn't really help, but is very likely detrimental to success. People come in more resistant, they're coming in, with more stigma that someone's forcing me to do this. I don't want to do this. I'm not going to open up. It's harder for the clinician, which, the job is not easy to begin with. But when you look at that, of course, more men are less successful in my realm of substance use disorders, but in treatment in general, because they are more likely to be forced. into treatment. And that is less likely to cause buy-in. And then men are not following through with that long-term care.
Mhm.
So I think we really need to look at like looking at the warning signs, which we've kind of talked about and we'll touch on again, how to get more men as practitioners in the mental health field. Because if people do not have role models that look like them, that act like them, that speak like them, they will not look at that as a potential field for themselves. And there's no role model for someone who is emotionally vulnerable and clear. And then we need to identify a way to get them to buy in and ask for the help. Because once we're forcing them, we're fighting an uphill battle.
Yeah. GB, you have a very unique business perspective on this.
Yes. So for me, I'll throw out some numbers, like just on a macro basis. If you see, the entire industry is very, very fragmented from a provider point of view. Many independent providers, around 45, which is almost half of the industry, do not take commercial insurance.
Mhm.
So what I see is there is a lot of talk about mental health, therapy. You have all these discussions and debates in the media. You have celebrities coming out talking about this, but when someone calls up a provider, he needs to wait 3 to 6 months to get an appointment. That that the difference between reality and what we see in the media, there's something which is not right,
Mhm.
and that's where we are trying to work in.
Yep.
So as I said, we operate a business called Turnwell. We have 80 providers on it. Everyone, like 85 to 90% of us, our providers take commercial insurance. They take government insurance, and the other part is so one part is accessibility to the service. The other part is quality of service, which is basically if somebody goes to a talk therapy and they are referred to a psychiatrist.
Mhm.
Again, I'll throw a number before I come to my conclusion and assumption. 65% of non-metro areas in the United States do not have a psychiatrist. So once you are referred to a psychiatrist, if it takes 3 to 6 months and you have to go to another city, the drop-off rate is huge.
Mhm.
It's probably more than 20-30%. When it comes to men, it's more than 50%. And come to think of it, a referred patient is more vulnerable than anybody else.
Mhm.
So in Turnwell, we have a full service, if not under the same roof, in the same MSA.
Yeah.
So we can treat the patients better. We can get them appointment as soon as possible. These are the things we are trying
Yeah.
to achieve. So yeah, I won't say my main complaint, but the thing that I want to see change in the coming years is accessibility of the service
Love
itself.
it. Let's come back to that for like the support. Renita, your perspective on this in terms of populations that really need the help across the board was like your story was amazing to me when we talked the other day. Tell me a little bit more about access.
So my story is my dad. He was a veteran, a Vietnam veteran. So I grew up in a household with my dad with PTSD and paranoid schizophrenia. I believe he was diagnosed prior to him being drafted to Vietnam. He had some childhood traumas. So growing up, I was under. I was diagnosed with PTSD, and my dad was a drug addict. So coming from Vietnam, he had a drug problem, and so in our house, when he needed drugs or whatever, it was very disruptive in our household. So as a child, I thought I was causing a disruption. If I could just be a little bit quieter, he won't just outburst and things like that. But, it caused me some anxiety and things like that. But I was a daddy's girl, so I would go down with my dad to the VA where he had to navigate these systems. So from knee high as a child, I learned about going to the VA and what my dad was fighting for his service connection disability from the VA. And in that process, we grew up in low income housing. That was something that was offered to veterans. I'm from New Orleans. So that was something my dad accepted, but he still was fighting for his service connection for his family. So I saw my dad going through this process and how it impacted out him himself with his other physical health conditions. as well as his mental health, but also our household. I have two other siblings that was impacted in the house when it was disrupted with my dad, and he had all these health appointments with the VA. They gave him like over 1,000 medications. It was just a lot that I saw him try to navigate, and he was persistent with that because he knew what was rightfully for him. So I got to see how to advocate and be persistent in advocacy. Um, as my dad, you know, went through that process, and I grew up under that, and my siblings as well. My dad finally got his 100% service connection. Unfortunately, he had passed away. He was hit by a drunk driver. So it's moving further. Fast forwarding, when he got hit by the drunk driver in 2000, my mom, 2 years later, no, a year later, my mom was diagnosed with MS. So that was trauma after trauma. Then Hurricane Katrina happened. So that was another trauma. So navigating all of that. And I myself had a nervous breakdown at age 19. And my mom and my dad was supportive of me. But my dad most so because he saw things in himself happening to his little girl. And he felt he couldn't protect me. So with that process, that was a lot for my dad to take. um but as I was coming through my recovery from my mental health breakdown, getting back on track with going back to school because I had goals and things I wanted to do, but when that disruption happened in my life, I felt like, okay, this is my lot in life. I'm going to live with my parents for the rest of my life. And my goals of becoming a social service worker and things like that just dissipated. um but moving forward, as I started navigating systems, learning from my dad how he navigated systems like Division of Vocational Rehabilitation Services, I got connected to that organization. It's a state funded and federal funded organization that support people with disabilities with supported employment. So they actually paid for my schooling, where I got my degree in rehabilitation services and counseling. Um, then moving forward, once I graduated, my dad, like I said, he was killed by a drunk driver. Then my mom, she went into the hospital for 5 months, maybe a year after, came out using a wheelchair while I'm in my program of study. So it's paralleling to what I'm learning in school.
Yeah.
And so now I'm supporting my mom in real time, what I'm learning. And so all of that process, then the hurricane, of course, was trauma after trauma, and I didn't recognize that I was in survivor's mode when I moved to Washington State
Yep.
and relocated. So it's been a journey and a process, and I found my voice in advocating for my mom as I was on my journey in recovery, and then taking the things I learned from my dad as he showed me how to be persistent in what I deserve from my tax dollars that's paying for these
Great.
systems. So that's kind of the perspective I'm coming
Yeah.
from, coming along someone in their journey to get back and re-engage with community.
Love that, Renita. And
Mhm.
Valentino, your story, like I love the way you talked about it. So I'm kind of gonna work our way. I'm gonna ask you like kind of two questions, and we'll kind of work our way back. Which is, you have this unique perspective of like come from the dementia side and the home care, but you had this like very, very personal thing. So a little bit of like access, but let's talk about how we support people, because you brought up the idea of early warning signs and how do we see this stuff, and show me you know me and all that sort of stuff. So you
Yeah.
can tie the two of those together and we'll kind of work our way back because
Yeah, so after he committed suicide, I thought about it and I was like, wait, there was all these signs way before this happened. So COVID was just the last straw. So all the warning signs of, financial, there was money issues, and we didn't know it was as bad as it was
Mhm.
until he did it. And then it was COVID is what did it for him. It was like overnight, we had all this business. We were profitable after the first 6 months of opening, but it was like all that business overnight was just canceled. So nobody wanted our caregivers to go inside their homes because they were afraid, everybody was. So all those, visits got canceled. So we went from all this business to nothing. If I would have saw that was one thing, the isolation. Like he used to always reply right away, to emails and things. Well, he started taking longer and longer, and where it was going to days and days, and then finally was to where he wouldn't even respond at all.
Hmm.
And, so it really, and I didn't know him well enough outside of work. I knew him, we went on sales calls and things all the time, but we really never, I didn't really know too much of it, but there was other things.
Hmm.
Apparently he had a breakup 30 days before this,
Okay.
7 years, and we didn't know. But the signs were there, and I wish that I would have known ahead of time, hey, there's something going on, because maybe I could have helped.
Yeah. Almost like this peer support network, right?
Yeah, exactly. And it's at work, a
Yeah.
lot of times you don't know them, especially your bosses, you don't know them that
True.
well.
Yeah.
But, they're having things and it was right there in front of us.
Mhm.
And when we thought about it, we're like, okay, it was there a long time ago.
Exactly. And Renita, we talked the other day about how like some of the work that you're doing is actually helping kind of create these peer support networks where the people that you work with, you're actually training some of them to be able to be they're not a clinician necessarily, but being able to support people. So maybe 2 minutes on some of the work that you're doing there.
Yeah, so certified peer counseling. So my experience after the hurricane happened, when we relocated to Washington State, I became a case resource manager with Developmental Disabilities Administration, and I didn't realize I was in survivor's mode. Trauma informed approach was not talked about. I'm coming from a southern region to a northern region. I was not aware of passive aggressive behavior. So all of that was going over my head because again, I was in survivor's mode. I just thought, oh, I got a job. I can pick back up where I left off, and not realizing I'm managing my mom who's disabled now. I'm helping her to manage and get back her life. I'm trying to control my life,
Mhm.
but my job was a refuge for me because I got to give resources and support people, but the biasness that I was feeling in there, I felt like I was going to have another breakdown. So I reached into my toolkit, what I knew from what I had experienced early on, and reached out to a therapist. I took time off from work, and I got some support I needed. And long story short, I had the disability resign from that job for my health. Again, peer support, my employers was not aware of a natural disaster just happened and it impacted me mentally, emotionally. I was not even aware until I reached out to my therapist and we started talking about things because I didn't know how to process what I was feeling and I felt like things unjust was happening to me. So that led me to take a step back a year and a half from when I resigned from that job and my mom in the process transitioned. Um, and so I worked at a managed care organization, and it was like deja vu, just different faces. And so from that experience, I was let go from that job after 3 years being there. And when I was let go from that job, um, I was led to start working in my own neighborhood where they had people that I had blinders on working in a system that I didn't see that was right in my backyard. And so I started connecting to these individuals that had relocated to Washington 12 years ago. A older lady, she was maybe 70 years old at the time. She was helping a neighbor next door to her who had several small kids with disabilities. She had chronic health conditions and she was a Latina woman. And this neighbor was taking her to her job, no, taking her to doctor's appointments, her children to doctor's appointments, school, and advocating with her and for her. And she was not aware that she can get paid to do that as a caregiver.
Yep.
So I started telling her about those resources. Um, then I formed our nonprofit in October of 2019, that last quarter. By February of 2020, we got our IRS papers, and then the pandemic happened. When the pandemic happened, the lady I was mentoring, we both took the Washington State Certified Peer Counseling training. It was free prerequisite online training. We took the trauma informed approach training. Um, and then that led me to tap into wait, they have a lot of people that I'm coming across
Mhm.
that need some support with mental health and reintegrating back into community,
Mhm.
getting back on track. And I remember when I was in that place when I had my nervous breakdown and I needed peers and I came across some friends I went to high school with and they saw me after we had graduated. Now, this group of girls, we all had our visions and dreams what we would do after high school. But I had a bump in the road and they didn't. And they saw me in the local Walmart with my mom and they didn't recognize, they recognized me, but they told me, you don't look the same. My mom talked to them and told them what was happening with me. Immediately that next day, they took me out to lunch and we start reminiscing and talking about when we were in high school and what we wanted to do. And it snapped on me. It came back to my remembrance. I used to want to do that.
Mm.
And having them as peers around me, not judging me, but having compassion and empathy towards me and wanting to support me to get back on track, that started me on my trajectory to um, connecting to DVR services, going back to school, and then full circle having the peer run organization where Washington State is now, they have the certified peer program with those with lived experiences.
Amazing.
And we have a recovery residence under our peer run organization. We do supportive housing and employment where we're training those. That's our initiative. We're training individuals to take the certified peer training because 2026 is going to turn into a licensure program in Washington State for peers. So it'll be equivalent to a licensed mental health counselor where we can build Medicaid or any other insurance. And so peer support is very vital and important for anybody in any healthcare industry to have someone with lived experience come alongside them and support them so they can find their voice and get back on track. So it's very, very vital
Love that.
for that workforce that's
Yeah.
being developed with peer support. And it's across the states. They're trying to standardize the credentialing process, but it's coming. And that's something a guy talked about earlier about human commodity. That is a growing workforce. So I do
Baby steps,
encourage,
right?
yeah.
Baby steps all the time. States making progress.
Mhm.
GB, you said something earlier. Was talking as we're talking about like supporting people through their care journey, and something that stuck out with me the other day that you said is it's kind of the referral channel between psychologist to psychiatrist, and we have this like massive drop off rate. What are you guys doing to think about that and fix that? Is it more practices? Is it less practices? More practitioners? And I know Cassandra, you're gonna have like great perspective on this too.
Um, More integrated practices.
Okay.
So we have everything under the same roof or within like a few mile radius. Uh, when we start in any new MSA, any new city, that's our whole focus, so that
Mm.
we can provide the full gamut of services to the patients. We can serve them in the best way possible.
Mm.
So that's the entire process of giving out quality service. Uh, Touching upon like I'm so extremely unqualified to put my comments after Bhumika and Cassandra and all of you guys on the panel. But something we were discussing before, early on the table, I was talking to Dr. Burns there. We have been talking, and I've been listening to the panel discussions. We have been talking about identifying markers before you need care. Uh, and I just think mental health, healthcare in general is very reactive and not very proactive.
Mhm.
I think that is taken to extreme in mental health space.
Yep.
We are very, very purely reactive healthcare space right now. Uh, the only proactive thing that's done is on my annual physicals, my physician would ask me 3 yes or no questions.
And even
That's
that's a
it.
little bit reactive, anyways, right?
Yeah, and those are extreme questions. Most or 90% of the times I would say no to them. And why not just have one 15-minute session every year, if not every 6 months, with a therapist
Yeah.
who can talk to you, who knows your family history, and can detect those symptoms and something else. So again, current process, we are trying our best to bridge those gaps. Uh, but we need to be more proactive, and
Agreed.
we just need more ideas from the provider community. So
Agreed. Cassandra.
Yes.
So we've talked about getting forced into treatment. If you get forced into treatment, how do you keep people in it? But even people that aren't forced into it, like as a clinician, how do you think about making sure that people kind of stick with it?
Well, so I want to piggyback off of a couple of things that I just heard. So, GB, you were talking about integrated care, and Valentino, you were talking about warning signs and things like that. And when we're talking about men and mental health, the warning signs are different. than a female in mental health. A female can come to you and say, I'm feeling emotional, I'm feeling heightened, I'm feeling anxious, I'm upset, I'm isolating X, Y, and Z, right? Because we are conditioned from the time we were born to engage in our emotions and be the hysterical gender, right? So we're okay with that. But for men, the warning signs are really what Valentino was talking about, which is that isolation, but we're not saying we're feeling isolated, we're just stepping back. Or specifically in physical health manifestation. And so integrating the care, when I go to my primary care physician, if I'm a male client, and I say, my stomach is really upset, or my head hurts all the time, or X, Y, and Z, this is what we're looking at with primary care physicians not saying, oh, hey, cool, let me give you an antibiotic right away. Or let's see what our situational stressors are. Let me connect you to a therapist that hopefully I have in-house, or at least I'm connected to in a certain way, so that we can determine if this is mental health or physical health, because they're too connected for us not to be connected as a mental health provider. And then additionally to that, one of the things that I'm working really hard with Paramount Wellness, but in general in the field, is to encourage and support male practitioners in the mental health field. So if you look at the studies, 19% of mental health practitioners are male. That is a disparaging number in comparison. And so we talk about this a lot with females, that if they have sexual trauma or trauma in general at the hands of a man, they're unlikely to share with a male therapist, right? That's a really common narrative. But what about the men who are uncomfortable sharing with a female because of the stigmas of being a man? And I'm conditioned from the time I was born to be manly, and I'm not going to feel my feelings. I'm just going to be angry and punch this wall. And then I have to go in and talk to a female and let this guard down of this manly machismo. And so one of the things I'm working on, I do have a full-time male clinician that we run gender specific group, and most men are either asked prior to, do you feel more comfortable with a male or female? Or we place them with the male in case.
Like proactively with a male.
Correct, because we would do the same thing for females. That if I have a slot with my female therapist and a female is coming up from detox into rehabilitation, why wouldn't I place them together?
Sure.
Right? So being trauma informed on both sides of this spectrum is really important. And then just looking at, culturally and generationally, is this field even supported for men? From the time I know that when I was a kid, like being a therapist was a thing.
Yeah.
It was a potential thing for me. And I'm not sure that that's true with the male gender.
I never thought about it.
Weird.
Didn't even cross my mind. Although my psychologist happens to be female, and it's interesting you say that because even when I think about like some of my like physical things, like physical therapist or doctors, like I always said, male doctor, male physical therapist.
Yep.
Over my entire care team, including my endurance coach, female.
I mean, I got to be honest with you. I don't know that the option to have the male was there.
I don't think it was,
right?
yeah, to be
Because
honest.
otherwise, hopefully, they would
Actually,
proactively share it.
actually, to your point, it's just coming to my head right now. It's when I was younger, my parents wanted me to see somebody. It was a male guidance counselor at the, at
Yep.
school. But it got forced on me.
Yep.
I said, I'm not gonna do
And
it.
that's true very often of mental health and substance use. They revert, if a client is struggling with that, you're going to revert to the time that that started.
Yeah.
And so you're talking about adolescence, but how is that very much different than a 25-year-old who's been forced into treatment the entire time and never actually addressed their issues?
Wild.
Wild.
It's wild. It's kind of like everything we've talked about right now is one of my, and Craig, I'm going to call on you for a second. You don't have to say anything, but one of my clients is Craig Mason, it's a startup, but he has formulated Raise High, which is how do we get into, all the modalities of communication, Slack, text, email, even if people are on the phone and listen and connect the dots for preemptively identifying suicide ideation. To your point, when you say something, not everybody, Valentino, to your point, nobody catches those warning signs. So how can we use technology to not just throw AI at the problem, but actually assist practitioners and folks in higher education or in schools to actually catch these warning signs where I know we're talking about men's mental health right now, but it is very much omnipresent across the industry of like, how do we actually support these people that, I tell Craig as we go through our strategy sessions, it's even if you're a clinician, you're a person, and there's going to be in that 55 minutes, your mind's going to probably wander a little bit because we're human. So how do we make sure that we connect those dots, make sure that we don't miss anything?
Yeah, and I think that's a really important piece of using AI, which I didn't necessarily anticipate coming into this panel, but
I didn't either.
it's, I just had this discussion with somebody else. The AI in the behavioral health scope, which is my scope, is a really promising endeavor, but it's also a little cold. So we need to work on that because my whole scope is being warm.
Totally.
And then the only other thing that I wanted to piggyback off of in the last panel, for those of you who are here, I believe his name was Brian, but he's been talking about recovering out loud.
Mm.
And that is the other piece of supporting and encouraging and empowering men
Yep.
to come into the field and say, I either want to help others, I want to support others, or I need help and support.
Mhm.
Is because others that have been, in their lifestyle or look like them, act like them, speak like them,
Mm.
are recovering out loud, whether it's from substance use or mental health.
I love that. Go ahead, Renee.
Yeah, I want to jump in. The Black community, with mental health and stigma. That's something that our community have not kind of used the system, mental health system. We've relied on the church or our neighborhood community, because we don't see people that look like us that could relate to our experiences. So one of the things that we are reaching out to is to the BIPOC community, doing our peer outreach and initiatives to the Black, Indigenous people of color, to see more people that look like the community
Amazing.
that's being served and that need to integrate with the peer services, because we're doing healing circles as well, because it's generational trauma.
Yeah.
And people have held a lot of stuff in, because in the reality in the Black community, we feel like we live in two Americas. So we have to kind of assimilate, and so we can't fully function as our full self.
Yeah.
So coming into a space where you see people that look like you, and you can release a lot of stuff that maybe started in childhood, but it's generational. And now you have to navigate this larger system that may be biased to you. So creating that space where individuals can come into and just
Yeah.
breathe
So
and release and heal before we can get into, let's get some vocational training, let's get you connected to peer services, but we also kind of redirect them to mental health services and things like that. So we kind of a supplement to the mental health service and the clinicians with the peer support that we're offering.
And I think supporting that, and I'm sorry to jump in here, but
Good.
I kind of love, we're kind of in the same sector and
Mhm.
supporting human beings.
Yes.
But in speaking about that, you have the Black community that really does experience this, and then you have the Black men, which is also like a double,
Mhm.
minority in that realm. But one of the things that you're talking about, and one of the things that I really strive to do, and I think is the field we need to, is to honor someone's experience.
Yes.
And so when I have a male client who comes into my office, and I'm never going to jump in and be like, hey, cry, tell me all of your things. Do you know what I mean?
Man, that might feel forced.
Weird, right? God, Anthony, cry.
Jeez.
But the thing is that it's about honoring and saying, as a clinician, as a therapist, I understand, or I hope to understand. Please help me understand
Yes.
that your experience as a male is different. And this probably walking into this room was very, very difficult. And I support and honor that.
Yes.
Yeah.
And then that allows us as practitioners in whatever, realm of this field we're in to encourage the next generation of that, that gender to come through.
I love it. I know we're coming up on time, so we'll just wrap up with each of us. We'll give 2 sentences on what are you most excited about or proud about or looking forward to in the next 2 to 3 years on men's mental health and the progression that we're going to make or are making. Valentina.
I would say affordability,
Yeah.
because healthcare, especially since COVID, has went really skyrocket in all sectors in healthcare, from senior living to adults
Yep.
that are not seniors. Like, it's everywhere, and it's really destroyed the healthcare market in general.
Yeah.
So I would like to see more access to mental health,
Sure.
because there's a lot of times they have them, but they don't want to admit it that they have mental health issues. A lot of times they don't. So as a dementia practitioner, I see a lot of times you get those symptoms mixed up with mental health, and
Yep.
then mental health to mixed up with dementia, because those behaviors, they're they're similar psych behaviors that happen, and a lot of times they are not getting the proper health care that they need, because they think that they may have dementia, but it's not dementia.
Yeah.
It's really they need mental health,
Mhm.
help, and they haven't had it.
I love that. Renita, 2 sentences on what you're most excited about for mental health and men's mental health in the next couple of years.
I'm most excited about the developing peer workforce and seeing more people of color get into becoming peers, where in general, people with lived experience where they're recognizing and they're getting knowledge about, they have opportunity to use that lived experience to earn a living.
Hmm.
As a certified peer counselor, as a licensed peer counselor, as this workforce is developing, and our organization, Caring with Compassion Community, is kind of at the forefront in Washington State. They have a lot of things that Washington State is affording in the behavioral health realm for providers, for profit, nonprofit, with recovery housing, with peer run organizations, just a lot of things that I believe Washington State is on the cutting edge of. And we're looking at Caring with Compassion Community to go global with what we're doing with peer support. And I believe that in every industry in the healthcare field, a peer need to be in that community,
Love it.
support individuals on their journey to health and wellness in recovery.
I love it. GB, what are you pumped about?
Um, as a society, I would say like we go through 4 steps in healthcare. First is talking about it. Second is people realizing it's okay to ask help. Third is getting that help, accessibility, and the fourth is quality of service.
Hmm.
Get all the help that you need. I think we have already started talking about it,
Hmm.
be it media, celebrities. Uh, I think men's health is in that first phase. We have done that. We have started talking about it. We need to continue doing it. I think I'm excited that we are entering that second place where, as men, we think that it's okay to talk to people, talk about our feelings, talk getting a therapy session, and I'm I hope that our third and fourth phase are much shorter than the first two ones that we.
Agreed. Agreed.
Agreed.
Sandra.
Yeah, I think I'm most excited about something we've already touched on a little bit, but really the integrated approach of medical and mental health, behavioral health.
Yeah.
So as Paramount, we've partnered with Poplar Wellness, which is a live feed of 24/7 vitals in our detox. And so we have medical monitoring 24/7 of our clients who are there for behavioral health. And I think in doing that and in the approach that we're taking, we cannot ignore that men's heart rates going up and blood pressure being higher and they're having psychosomatic symptoms.
Hmm.
You can keep treating it with all of those medications and it's just not going to work
Yep.
because psychosomatic symptoms don't stop unless the anxiety or the depression or X, Y, and Z is processed. So I'm very excited about being part of the approach that integrates those two models.
I love that. And I'll just kind of wrap it up as, as if I look at who's here, even the conversation that we're having, even like the complexity of who's on stage right now, this to me is a major step forward.
Great.
A couple of years ago, the pandemic accelerated some of these conversations, but we're now having this in a very dynamic way with people of all ages, races, complexities, perspectives, locations. And I think we are actually, GB, to your point, I think we are shrinking
Mhm.
the later stages of that. And that to me is exciting right in the moment. The next couple of years, who knows, right? But I do think we're well on our way with actual treatment, digital modalities, all that sort of stuff. And I think just the fact that we're having this conversation today and Health 2.0 decided to have a specific panel on men's mental health is a very big step forward. So I'll wrap it up there. Thanks everybody for hanging out until 5:15 at the end of a conference day, but this is
Thank you.
amazing.
Thank you.
Question?
All right, guys, round of applause for our last panel. Such an interesting topic. Thank you so much for all of your time and all of you who are still here. Thank you. Thank you. We are right about to get into our awards recognition section of the day. And after that, of course, our coveted cocktail hour. Hey, that has a nice ring to it, doesn't it? Before we do that, it's time to recognize, of course, you, the luminaries who directed their efforts toward driving growth in the industry. We're not only highlighting the leaders of the healthcare industry, but also honoring a few incredible organizations. Here to help me and be my Vanna White to present the awards, we have with us Gary Wu, CEO of Total Max Homes. Come on up, Gary. Hello, round of applause. Thank you. Thank you. Thank you. And now we are just going to get all of our awards together and ready. Okay, I got the okay that we are ready to roll. Our first award for the Health 2.0 Conference Visionaries Award goes to Isaiah Coles. Isaiah, please come on up. Isaiah is the Chief Operating Officer at Outreach Recovery. He is an accomplished and results-driven leader recognized for professionalism, commitment to excellence, and demonstrated ability to communicate and work with senior management, associates, and customers. Maybe he's not here. Isaiah going once, going twice. Well, hey, then we went through a practice run. Yay, Isaiah. We will send it to him. Sending lots of love his way. Our next award for outstanding leadership goes to Adam Steinley. Adam. I know everybody started cocktail hour already. Man, they're like, I'll get my award later. We're in Vegas. Moving right along, our next award for outstanding leadership goes to Adele Abdullah. Adele. All right. You made the right choice. Adele is the president of Positron Corporation, a publicly traded company that manufactures, services, and sells PET and PET-CT scanners. Also, we are able to offer you a 1-minute time on the microphone if you'd like to speak. I am more than happy to step out of the way. Totally up to you, no pressure. All right, here he is.
Thanks for having me here, and congratulations from my team. This is this is nothing, just a hard job from my team, and I could not have this award without them. So they're a family of Positron, and I thank Health 2.0 for this recognition. Thank you.
Our next award for outstanding leadership goes to Anissa Mustafa. Anissa. Woohoo! Anissa is the founder and CEO of Person Centered Empowerment with a diverse array of roles spanning entrepreneurship, leadership, mentorship, training, advocacy, and speaking engagements. Anissa brings a wealth of experience and expertise to their community. No pressure. Great job. Our next award for outstanding leadership goes to Ankush Kona. Ankush. All right, here he comes. Ankush, the data and AI advisor at Auxo AI, is a strategic and highly accomplished leader in the life sciences, healthcare technology, and engineering fields. Ankush's expertise lies in implementing effective changes to propel the attainment of critical corporate objectives, evidenced by his proven ability to streamline and optimize processes and heighten efficiency. And round of applause. Everybody's a little shy today. That's okay. Our next award for outstanding leadership goes to Anthony Nelson. Anthony, I know you're here. Anthony is the founder and managing partner at Growth Culture. He is a leader with a simple mission to empower those around him to learn and feel empowered to make strategic decisions with conviction. And of course, we just heard from him. And if you'd like a minute to chat, we'd love to hear from you again. Good? All right. So humble. And guys, we will be getting these pictures to you in the coming weeks. And of course, you're more than welcome to reach out to the team to ask about them as well as we move forward. Our next award for outstanding leadership goes to Blair McCormick. Blair. All right. Blair is the executive director of the Calgary Fetal Alcohol Network, CFAN. With a rich background spanning 25 years in the nonprofit sector, Blair is deeply committed to serving the broader community. In recognition of his impactful contributions to the province of Alberta, Blair was honored with the Queen Elizabeth II's Platinum Jubilee Medal in 2023. Wonderful.
I'd like to thank the Health 2.0 conference for this recognition. It wouldn't really happen without my team back at the Connect FASD program. They're the ones that really drive everything. And I'd like to thank my wife, of course, who's the one that keeps me going, especially supporting my strong mental health. So thank you.
Always thank the wife. Good job. Our next award for outstanding leadership goes to Dr. Christian Nikanu. Dr. Christian, please come up. Dr. Christian is the Director of Infection Prevention Control at Vitalite Health Network. He is a positive and upbeat, experienced clinical specialist with a demonstrated history of working in the medical practice industry. Dr. Nakanu has expertise in virology and occupational health and the ability to learn new processes with computer abilities. And I had the pleasure of having just a nice chat with you guys during lunch. So, oh, yes, you're more than welcome. Yes.
Thank you so much. I came from Canada and I'm very honored to be here. And thanks to the Almighty God who uh, put some incredible people on my way. My wife, who is there with me, my dad, who passed away, my bosses. I'm from Vitalite. Vitalite is a bilingual health network in New Brunswick, Canada. And as a leader who came from a visible minority, like from Black community, this is an honor for me to be here. And I thank all the organization here. Thank you so much.
And our next awardee goes to the award for outstanding leadership, Deborah Simpson. Deborah. Ooh, and she's got a protege. Oh, okay. Going once, going twice. Gambling. We'll check her Instagram later. Our next award for, oh, I know her. I like her. Conference Visionaries Award is Dr. Stephanie Bradhurst. Dr. Stephanie, please come on up. Dr. Stephanie is the private psychosexual therapy practitioner at Bathurst Family Therapy, LLC. She's also a world-renowned clinical sexologist, relationship therapist, and holistic healer who applies evidence-based techniques that blend holistic and traditional therapies. As a provider, she aims to energize relationships, unblock barriers in the 8 forms of intimacy, and treat the whole system so clients can see long-lasting effects. Would you like to talk to me?
Hi, everyone. Thanks so much for having me. We've worked really, really hard since opening our doors in 2014 to kind of holistically blend sexual optimization with relationship restoration, and we're really proud of everything we've accomplished. Thanks so much. Appreciate it.
Our next award for outstanding leadership goes to Holly O'Keefe. Holly! All right. Holly is the owner of Where You Are Counseling and is a licensed professional counselor. With over 15 years of clinical experience, Holly has provided counseling to seniors, adults, adolescents, young adults, and children of all ages. Holly has expertise supporting individual clients in group settings, couples, families, and within a classroom. Congratulations. Our next award for outstanding leadership goes to Jeff Hutchinson. Jeff, come on up to the stage. Okay, sending congrats applause to Jeff wherever he is. Right? Gambling, drinking, buffet, or sleeping, who knows? Our next award for outstanding leadership goes to, it's another Jeff, Jeff Kraber. Jeff, please come on up. Yay, this Jeff is here. Jeff is the founder and CEO and president of JBack Consulting. He is an IT consultant with over a decade of experience in the industry. We just saw him in one of our panels. With a strong foundation, Jeff has helped many organizations protect their people and assets with physical and digital postures and navigate the evolving threat landscape.
First off, just want to thank everybody within our community and our organization helping us get to here. Thank you for everybody within this organization for putting this on. We're very thankful to be here and couldn't do this without my wife and my 4-year-old who just celebrated his birthday. So happy birthday.
Our next award for outstanding leadership goes to Lori Ellington. Lori. Lori is the founder and chief executive officer of Ancient Science Inc. Lori has over 25 years of experience in mind-body medicine, coaching, teaching, consulting, and leadership. She's on a mission to expand consciousness, turn trauma into healing, and transform the world with kindness and compassion. Love it.
This is not made for people my size. So super honored. Thank you, Healthcare 2.0, for giving me this opportunity. And honestly, I'm just getting recognized for my purpose. It's the reason why I'm here to alleviate suffering, lift others up. And I couldn't be more grateful for all of the many people who have done that for me over the years. So thank you so much to those who aren't here to get that, and for you as well. Thank you so much.
Our next award for outstanding leadership goes to Lloyd Duplichin. Lloyd. Serving as president of the Healthcare Environment Institute LLC consulting firm, Lloyd is an accomplished, performance-driven, forward-thinking healthcare executive and consultant. With 40 years of experience in healthcare leadership, he has performed leadership and consultative roles in the commissioning, construction, and licensing of 4 general acute care hospitals and over 45 successful accreditation surveys.
Thank you for this remarkable award. I'm honored and profoundly humbled. Thank you.
Our next award for outstanding leadership goes to Maria Burke, RN. Maria, here she comes. Maria is the owner of Celtic Angels Home Healthcare. She served as a visiting nurse and soon launched her own home healthcare company. Her staff, which includes certified nursing assistants, home health aides, and registered nurses, provides a variety of services, including skilled nursing and many other in-home healthcare services. Come on up.
Just 2 seconds, I'm ready for the cocktail hour. I just wanted to say thank you to Health 2.0 for this beautiful award. Thanks to all my beautiful Celtic Angels, nurses, home health aides, CNAs, PTs that are out there working in the homes every single day, 365 days a year. And thank you to my partner in crime, Joe Burke, who puts up with me day in and day out, my hubby. Thank you.
Our next award for outstanding leadership goes to Poria Sadgi. Poria, please come on up. Round of applause for her, wherever she is. Oh, I love that you all clapped after that. Gosh, you guys are great. So compassionate. I like it. And moving right along, our next award for outstanding leadership goes to Ranjani Sampath Kumaran. Ranjani. Ranjani is the founder and CEO of Finesse Consulting. She is a passionate technology person with a master's in biomedical engineering and an MBA. Sam brings over a decade of experience in various roles in the medical device industry, including R&D, product management, and project management as well. Product and project management. Sam truly enjoys consulting for medtech clients in the project and product management space.
Thank you everyone for holding up until more than 5 p.m. at Vegas. Appreciate the organizers for organizing this. And I just wanted to say no leadership award is possible without a great team. And thank you to my clients for having the faith to have made me stand here today. Thanks.
Our next award for outstanding leadership goes to Samantha McAvoy. Samantha, it's your turn. Here she comes. Samantha is the co-founder and CEO of the Society of Growth, Inc. She is engaged in many projects across teams of organizations with varying complexities. With a heavy project management and behavioral health background, Samantha found her passion in the social determinants of health. All right. Why not?
Usually the other co-founder does all our speaking, but I just like to give a big thank you to my business partner. The whole community. Working in a rural community is sometimes really hard. Um, our partners, and then most importantly, my husband, who mans our 4 daughters most of the time while I'm at meetings and trying to save the world. So thank you.
I want to give a big shout out to all of you guys for still being here and applauding, giving so much love to all of your fellow nominees. Fantastic. And of course, each and every one of your turns is coming too in the next 3 days. Our next award for outstanding leadership goes to Sanjay Gupta. Sanjay. Sanjay is the Vice President of Integrated Supply Chain at Embed Biosciences, Inc. With over 2 decades of experience in the healthcare supply chain, he's currently running a medical device company specializing in advanced wound care. Sanjay has demonstrated his expertise in developing world-class supply chain solutions for healthcare companies with a strong emphasis on design development, sourcing, regulatory, quality, manufacturing, and eventual commercial release.
Thank you, L2.O team, for recognizing my overall work in the healthcare industry. All I can say is I have a personal mission to save lives, even though I'm not a doctor, because there is one great doctor, Dr. Sanjay Gupta. But what I feel is how I can utilize my own experiences in the supply chain to support all the big medical device companies, all the big entrepreneurs who are coming with the new technologies, which we had even discussed today. Um, I feel a great proud in supporting all these endeavors. Thank you.
Our next award for outstanding leadership goes to Scott Hoots. Scott. Scott. Okay, moving on. Our next award, also for outstanding leadership, goes to Sujanya Konda. Sujanya. Well, we'll keep going down our list. Nope. Our next award for outstanding leadership goes to Stephanie Ganem. Stephanie, oh, there she is, looking lovely in orange. Stephanie is the clinical professional counselor of Calm Gardens Therapy. As a full-time mental health therapist, Stephanie utilizes her expertise to provide compassionate care and support to individuals navigating various mental health challenges. Through her leadership, Stephanie has fostered a culture of learning and growth within her practice.
Wow, thank you guys so much for this recognition today. I am overfilled with joy and gratitude, and it's just such an honor to be in the same room with all you intelligent, beautiful people. So thank you so much. A lot of work went in behind the scenes, and by the grace of God, I made it to this point. So I'm very grateful, and this is just the beginning. So you'll see more of me. Thanks, guys.
Our next award for outstanding leadership goes to Tiffany Carr. Tiffany, there she is. Tiffany is the director of software sales at Compound Live. She has over a decade of experience in SaaS. She uses her sales expertise in maintaining and flourishing client partnerships, sales cycle management, business development, and implementation. Congratulations. Our next award for outstanding leadership goes to Dr. Udam Isang. Dr. Udam, please come up. All right. Dr. Udam is the visionary CEO and founder of Sunny Therapeutics. With a background as a physical therapist, educator, coach, writer, poet, dancer, and teaching artist, Dr. Udam advocates for holistic well-being, integrating mind, body, and spirit. The mission resonates with their multifaceted essence to heal with their hands, their heart, and their voice.
I thought I was going on tomorrow. I didn't even know. So yeah, thank you for having me. This is an honor, and I can't wait to continue to do the work that God has called me to do. Thank you.
And moving right along, our next award for outstanding leadership goes to Lauren Florek. Lauren. She will get a package in the mail. And last but not least, our final award for the day for outstanding leadership goes to Gaurav Bandari. Gaurav, please come on up. He is the Senior Vice President of the Direct Investments Division at Leon Capital Group with an emphasis on healthcare. He has over a decade of experience in investment banking and consulting before working with the healthcare portfolio. Prior to joining Leon, he's led the growth teams of private equity-backed healthcare companies in dental and physical therapy.
Thanks, Health 2.0. All my thanks goes to all the providers in the field who makes it easier for the patients to get access. I'm really grateful to you. I'm not a provider. I don't do much. So thank you. This is all for all of you guys.
Guys, one more round of applause. Congratulations to all of you awardees. You guys are all superheroes in this room, seriously. So before we end this, I want to give a big shout out one more time to some of our sponsors. Big shout out to Flow Patterns and Zaniz Health and Fitness on behalf of the Health 2.0 conference team. Thank you for helping make this event possible, supporting us in this way. Couple of quick questions. Who learned something new today? Show of hands. Great. Who made a new friend today? Show of hands. Okay, this one's fun. Who made a global or international friend today? All right. And for those of you who didn't raise your hand, we still have 2 days. So I'm going to quiz you all again the next couple of days. As we draw the curtain on today's insightful discussions, let's turn our gaze towards our next installments. You're going to hear me talk about this a few more times the next few days. Our upcoming editions in the US and Dubai are your passport to professional excellence. Ready to embark on your next adventure? Visit our booth next to the registration desk. or get in touch with Jatsin Sidhu and Shobit Bahal for all the details. And again, we would love to have you guys back at our next same conference, our next event. And when you go into the lunchroom, I'm calling it, and straight down to the left to the front door that way, that's where our Health 2.0, and I should say just the booth is to contact these guys and get more information. And of course, I'm more than happy to make that connection for you as well. All right, let's keep the momentum going and build even more connections before heading out to explore this beautiful city. I look forward to seeing you all again tomorrow, same place, same time. Have a wonderful evening. Please join us right next door for cocktails and networking. And remember, what happens in Vegas does not stay in Vegas. It goes online, so be careful. And of course, we want to be a part of it all. So please hashtag us, hashtag health number 2 CONF. Have a wonderful evening, guys. See you tomorrow.